today.
Go ahead and introduce yourselves and let's hit your highlights.
All right, Jason Dye, Trial Court Administrator.
Ashley Greenhurst, D6 treatment.
Victoria Hall, Jury Commissioner.
Should we
So-
start with jury real quick and then you can go back to work?
That's easy.
Well, I'm not working today,
Yeah.
but yeah.
Oh.
That's interesting. Just walk down the hall and see everything closed.
I know. It's a weird thing. We'll have to talk about it. All right.
So do you want to start out with jury?
We're on page 43 and then you'll just, Tori's going to run through her jury
Okay.
lines.
Mm-hmm.
And actually, your operating stuff's on
It's
44.
on 44.
Yeah, and that's what she'll be running through. Go introduce yourself and go.
My
She
name-
already did.
Yeah.
Okay, then go.
Okay, great. I only have 7 lines on these ones. The short version is we saved 8,500 and are asking for 8,500, so it's a wash on my budget. The reason that it has the bump up of 8,500 is just because of as many trials. We're just doing more and more trials. So where you'll see that is the selection, jury mileage, and jury amenities. That's just so we can pay to get the butts in the seats, we can pay for them to drive here, and then the snacks to stay awake, and the drinks and the things like that for lunches and dinners and whatever it is. The cuts went from operating supplies for the minus 500 and the postage minus 8,000, and that's just because we have a new jury software where the system sends out the questionnaires and summonses, so we don't have that.
Easy?
Yep, that's an easy one.
And I'll tell you what I enjoy is this office has started putting the jury all in one on paper and all report instead of all mixed in. That's made it a whole lot nicer and realize how much is going on.
And we appreciate that we can actually upload that instead of do manual entry for all of those
Oh,
payments.
wow.
Mm-hmm.
Yeah.
So that's been nice too.
It's been interesting to watch.
Yeah.
All right,
That's
any
it.
questions?
All right, you can scoot.
Thank you. Yeah.
Do we want to bounce to D6 and then Ashley can
Yeah.
go?
That'd be great. That way I don't have to.
And is this the same 2 pages? Or
Yeah.
one?
85.
Well, that was really quick, so hopefully this will be.
Hopefully this will be
85.
15.
So we have.
Hang on a sec, we gotta get
Okay.
there. She's a few pages away.
No problem. I had to switch around on my computer too.
Those supplements. That's funny. Okay, go ahead.
Okay, our first big, under the, our first big request is a new position, which we would be requesting at a grade 13.
What's the title? Which one? What's it going to be for? A treatment counselor?
Yeah, treatment
Treatment
counselor.
counselor.
I'm sorry, what's it for?
Treatment counselor.
Another counselor position.
It's under the, it's line, is your, the same
Yeah, mine
Yeah.
should be same, it'll just say new
Okay.
position.
Yeah.
new position?
We just
And
didn't
then-
have a job title, so I had to ask what it was.
Okay.
Right.
Under the description, it says treatment counselor, that's what, and we just kept it at the same cost as the other requests and put on the note that it would be a grade 13. And I don't know if they would start at a lower amount as that, but that we would be requesting that. The reason why we're requesting that is for multiple reasons. Number one is treatment courts are bouncing back from pre-COVID and COVID numbers, and so most of our treatment courts are getting up to actual capacity numbers, and so there's an increased need in being able to provide services for the increased participants. We're also, there's gonna be some changes that are coming across, and Ashley's the expert on this, so any questions you have for her, but we'll be doing a different intake. Where we used to do a gain assessment on intake, they'll be doing a CDA on intake, which will mean that it has to be a counselor that has a master's degree, where we could just use a CDAC previously. And so that we'll need to be able to handle that in-house for that. And then Ashley has a lot of administrative work, especially at this time where she's transitioning to Magellan, which is a whole new billing thing. We'll be losing WITS, which was the way that we billed for the Supreme Court. So she's working on getting all that stuff going and still carrying a caseload, which makes it very difficult for her to be able to do that. And so for those reasons, we're asking for the opportunity to add a counselor to be able to take on that caseload. We feel that we'll be able to have additional billing. We do have a cash reserve that we around 500,000. We don't have the exact numbers yet, but we'll be getting that from Christy soon. And as you look down further, we do have a contract line where the contract is increasing because of the increased need, where we started out just contracting a small amount, and now about $7,000, and now we've gone up to 19 and 23, 29,000, and now we're on track to break 20,000 this year because of the increased need. And so we feel like we could be able to handle that in-house better and be able to do that and reduce the addition and let Ashley be able to do more administrative work.
And this is an enterprise fund, so it's self-sufficient. We'll have to see and verify that revenues will be able to support this. And that's something that we'll work through with them as we do the balanced budget with the clerk's recommendation.
Any other questions or anything you want to add, Ashley?
No, I think you did a good job. I don't know if you guys have any questions about, like, as far as the contract with the gain assessment changing to a CDA. If you had any questions about that, I'd be happy to answer those if you wanted clarity on that.
Is that, I'm just curious, how big of a burden is that gonna be for you?
So right now, we've hired on a CADC to do a lot of our gain assessments, but this year, the state is moving away from the gain assessment. So she takes on all of our Idaho Supreme Court gain assessments. So, I mean, I'd probably say 50% of our gains. We do a lot in-house, but we use her. She does at least 3 to 4 assessments a week for us.
Mm-hmm.
So with that being eliminated, we have to do a cognitive diagnostic assessment, which is a master's degree person. So with the gain assessment leaving, we actually would just end her contract with us because we won't need her. I think they're really pushing us to be done with the gain assessment by October. So they're kind of giving us a little bit more leeway because a lot of this, court systems right now are still recommending gain assessments. So we have to have them adjust to say, we don't need a gain assessment, we just need a CDA. So there's a time frame there, but essentially we're going to be needing to eliminate the contract position and move all of that in-house. So, I mean, it's...
When you eliminate that contract, will you let us know?
Yes, for sure. Yep. So...
And if the position was granted, we would want to be able to make sure that we would see we'd want to be able to make sure this new revenue source of the assessments coming in and the additional assessments would be in line, and so we would be tracking that based on the new need and make a hire as appropriate. But we want to be able to do that, a request for the position, and then pull the trigger when it's needed.
It's available.
yeah.
So the bottom here, miscellaneous cost or expenses, $45,000 alone?
Okay, so when D6 was established, there was money taken from some problem-solving courts with the promise to pay that money back once the reserves were built up high enough. So that's what this is budgeted for. It's just to start that payback process. Because originally, what was the amount?
It was 90,000, and we haven't had any paybacks back. And it's not something that we're asking for this year unless there's a cash revenue balance. And so it's something that we would consider based on it. The max would be 45 this year, the max, and then asking again next year. But if it looks like that's not a possibility, then we would just do a reduced amount or none at all. But we wanted it on the line item if we had the revenue.
I'd never heard of it or seen it, so.
Yeah,
just-
like I said, it was just because when the fund was, or department was established, they needed startup money, and they didn't use county funds. They used these problem-solving
Okay,
fees.
yeah, I just.
And that was kind of the agreement, is like, we kind of hit our 5-year mark, if we have some cash reserve, like, now we need to start thinking about getting that money paid back.
Yeah.
So really, if our numbers are kind of tight, we could even lower that a little
Or
bit,
eliminate it.
$20,000 or something, so that we can afford to give the new position, something like that.
Jason just wanted to make sure it was on the radar
Yeah.
to start
Perfect.
the process.
Yeah, and we, like we said,
It wasn't even on the screen originally, so.
Which is exactly why it's on there.
and like we
So
said,
I was getting a loan, that's what my first question, what do you mean, a loan here?
The commission approved that upon the inception of D6.
Oh, that's funny.
and like I said, we're not going to want to break knees or anything to get it back. If there's not revenue for it, or if there's another need for it, we're just eventually want that back for the next project that we come across. But
Well-
it's not necessary that it has to come this year, but we'd like the ability to do it if it looks financially feasible.
Well, if we're giving loans, the group just ahead of you wants a loan.
I think they want cash.
No loan, they want cash.
Yeah.
And the next thing is where the rent will increase by 3%. We've seen that happening each year. And we're about 3 years from the contract being totally done and renewing. And so we wanted to put on your radar that it's at 115,000. If there's some sort of thought process in the future of a building for the commission that the county is going to purchase and there would be room, then we'd rather be paying a portion of that rent to the county instead of another entity to be able to be in-house. And so just thought process on that as we discuss on long-term plans, if we would be able to be part of those discussions.
What's your square footage right now, Ashley? Do you remember?
I don't.
I think it's like 5,500 square
Yeah, and we
feet.
added kind of our contract is actually, our original one is actually done, but we added 3 offices and a group room, so that's why our contract is extended. So
Mhm.
with that added piece, I'd have to go back and look at the exact number.
It's right around
We'll
there.
meet with them next week.
Is the subsidy that
And
Board
the
of Health Trust
tax
gives, is that
exempt.
going to change at all?
Mhm.
No? Okay. Just so I can project that revenue if it was going to change at all.
Yeah, right now, there hasn't been anything, and when we met with, I met with him recently to discuss drug testing there, and it just wasn't for us to financially to be able to do it there, but he still wants to be able to make sure that we're taken care of for as long as we want to stay in that
Okay.
building.
Which of that 115,000 Board of Health Trust charges a higher amount, but then they subsidize some of that money back. So we do have some offsetting revenue, and I don't have that with me right now. But it is money that does come in. I might actually have it. But anyways, so it's
Yeah.
not, we get part of that back. Just so that's known.
And then under professional fees, we're looking, that's our biggest increase there. We go from 7,500 to 20,000. We wouldn't need that we wouldn't need that increase if the new position comes into play and we're able to use that position.
You wouldn't need the total cost, or you would need a percentage of it, or a partial
My hope would be is if we hired a new person, that I wouldn't need a contract person at all.
at all,
Like,
so 20,000.
yeah, I wouldn't, I mean, I wouldn't need it, but if I don't get the new position, I'd like to keep my contract with us.
And that's our goal, is to keep it under 20, but as you see, fiscal year '23, we were at 29,000. And it's just hard to predict because the courts they're exploding as far as being able to take clients in now compared to previously.
And I think not just courts, but I think just the recommendations from probation, we've seen those increase as well, just more people need services. And I think that's kind of coming across the board with every agency in town right now with substance abuse treatment, is everybody's numbers are just up.
Okay?
Okay. Is there anything else you want to bring up?
Probably, do we want to talk a little bit about the possibility of software, like just in case?
Why don't you bring that up?
So with Magellan services are coming in to take over Medicaid, and that all ends July 1, Magellan takes over. We're working, on top of that, Teresa, my billing person, has resigned working with us, and so we're in a position where as she's getting ready to be done, do we look at rehiring her position, or can we find some software that maybe will help us be able to combine my front office person to be able to do some of the billing stuff with some software that's out there that would be more efficient. Instead of hiring two positions, can we keep one position and allow us to do some software? That's not in the budget right now, but I think it's just good to have on your radar. We're trying to figure out how to be more efficient in the billing process and cut costs, but be more efficient in that area. And I'm working with Christy to try to find the lowest cost. We're kind of talking with IT to see if there's a system that will help us there. We haven't purchased any system, but we're also kind of waiting to see what happens because WITS is going away, which is our EHR system. The state's going to go away from that, so we may have to buy an EHR system, which is a health electronic system. But we're waiting to see what the state does. It's like this complicated system.
Tell them what, it's for all of your notes, client notes, right?
Yes, all of our client notes, sorry.
So,
Well, like I say, if you're gonna need it for this fall and next year, put it in the budget somehow.
and potentially we could use that
That 45,000, I mean,
we are going to possibly work with, right now Indigent has a program that they track the receivables. So Adam doesn't know this yet because I haven't had a chance to catch up with him, but depending on how Magellan's going to work, possibly we could set that up just as a database, for lack of better terms, to put in the patient account balance and then track payments through it, and then that would also give us our receivables report that we need. So that might be free, but there might be the client notes that we would have to cover, so.
And
we'll
we're not
just
going to
continue
move to
work
the
on it.
note system stuff. They're going to give us another year, so we won't need to talk about that until this time next year. But I do think it's important for you to be on the radar because there are going to be lots of changes over the next year that we're going to have to look at. And I'm going to work closely with Christy. We want to be able to have a system that Christy can have access to, so she can go in and look at our billing and our revenue and all of that kind of stuff, so that auditing's involved in that, so that there's not such a discrepancy at times.
And then also Adam will be involved
Yeah.
with any IT.
Mm-hmm.
That's
So
one
it's-
of our major goals, is to be able to work as an enterprise fund to have more of a partnership with auditing and more transparency and more of an understanding. And then if there is a transition in the future, that it will be a smoother transition because they'll already know the data system and the billing system and all that.
We can help be backup for them.
well, and that's what I'm saying, because it's in the miscellaneous expenses, we could use the 45,000, but if you have funds or it's a desire you want in your programming, put it in, is all I would say.
And we can make sure that, depending on how it goes through the budget process, if we know more information before the commission proposed and commission approved, then we'll make that transparent. But if, say in January, we decide to use that money for software, we'll just come before the board. You'll have to sign the contract anyways, but we can come before the board and just explain for transparent purposes of what we're doing and why. That's usually what I ask
Mhm.
departments to do, so that it's open to the public, transparent, and of course the board knows about it. So,
Okay?
I think that's it for D6.
Yep.
Perfect.
Yep.
Any other
Thank you.
questions? Thank you for your time. I appreciate it. Thanks, Christy. I'll get with you for some other stuff.
all that email
What
stuff.
page are we
Yeah.
on now?
Thank
And
you.
we'll be back to 44.
40 what?
Thanks, Jason. Appreciate it.
43, 44.
Thank
See you later.
43?
Sorry, now you go back to your district court.
Okay, district court, just right at the bottom, we have a theme of asking for a 3% cost of increase plus appropriate step increases. And then we'll go down to operating supplies. This last year, the text notification, right now we have a current contract where we're trying to reduce the failure to appears in court, which causes the county a big expense to be able to reschedule those people, put a warrant out for them, have them go to jail. All that type of stuff. And so we have been successful. I wanted to give you exact numbers today, but there was some entry issues with how the clerks are entering it into Odyssey, which is now enterprise jury, or enterprise management. The input is a little different, so we're going back and fixing that to be able to get good quality numbers. But anecdotally, we've seen a reduction of missed appointments for court, but it also gives them a text notification to let them know when they have an appointment with their pretrial service officer, and they've seen a big reduction in missed appointments. And so there's some national data that also suggests that you would see a reduction, increase in compliance to payment plans for court fees and fines. And so our request today is to add an additional, to bump that up, to be able to add payment plan notifications to be able to increase our collection. There's been some great stuff that's already started to happen, tax intercept and collections through the Supreme Court, and so we've seen some success in that, but I think this would be able to help so that we don't have to resort to that part, and that we can get some compliance through that text notification. So it'd send out and say, when they start, it would say, this is your fee, this is how much you would get each week, month, and then it would say, you're just like a dentist, like a week before, your payment is due on this date, and it would give them notification of what the consequence would be if they don't pay, and then a payment, and then another reminder on the day of payment.
This is a huge one. These are the same type of funds that we were talking about the other day. That's the $23 million that's back owed to the county for different services or fees or fines.
Yeah. And
Or
this
restitution.
And this this would probably catch most of the people that are still in the system going forward.
Right.
And then the tax intercepts and the collections would capture the historic ones.
So is that full amount, that full 8,500, that whole thing?
No, it would go from, right now we have a cost of $2,500 for the text notification, and it'd increase it to $4,000.
So only 4,000 of that is, okay.
Is text notification.
And actually,
we
might move that to a contract services line.
Okay.
I just asked Caitlin to talk to you about possibly doing that later, but I think that might be a little more appropriate where it's going to be a consistent thing. But we'll work on that for the clerk's recommendation.
That sounds great. We've seen an increase in postage cost, and so we moved $25,000 from jury up to postage for the courts.
$100.
2,500.
Yeah.
Did I say 25,000? Oh, yeah.
Since we're on the record.
Yeah, 2,500. Thank you for that. And so we are requesting that to cover the postage. It looks like we're at 6 months, and so we'll need that to be able to cover the excess. And then for mental health examiners, with Magellan coming in and the changes on Medicaid, the costs have just gone up. for that reimbursement for mental health examiners and hearings, and so we requested a $10,000 increase to be able to cover that cost to capture that. And then right now transcription rates are the same. It's $3 a page, but the Supreme Court is doing a consideration that it will go up to $4 a page. We have a shortage of court reporters, and so it's very difficult to recruit them and keep them. We're lucky here because we're fully staffed with court reporters, but we're the only district in the state that's fully staffed with court reporters, and all of our court reporters are getting close to retirement and within the next 4 to 5 years, and so we're looking at that. So the Supreme Court is asking for an increase to be able to maintain and recruit new court reporters that come in. I have asked for additional fees from the Supreme Court to cover any additional cost as well. So we'll be able to do that. I was able to...
On this front page, before you go further, we talked about clothing.
Oh, yeah.
For robes?
How come we're paying for robes, dry
always-
cleaning and personal clothing?
Mhm, we always do.
I just giving Jason a bad
I know.
Gotta cut that out and
I know.
off.
So it's just been a historic thing that all the counties have paid for robes for their judges.
Well, we're not historic in Bannock County anymore. Believe me, we're making lots of changes.
Okay.
Honestly, we was talking about clothing earlier.
We were just talking about not buying clothing for departments just an hour ago,
Okay.
so.
So I had to
It's
give
just
him
funny, he's just jabbing.
Okay. I was just thinking, oh no, I didn't.
I
put it
want him to
into
go
my
tell the
statement.
judges, do your own dry cleaning.
Yeah.
All right, go
That's
ahead.
what my wife, when I did take judges' robes to get dry cleaned, and one of them was broken, so I stitched it up myself, and my wife was like, I didn't know a TCA would be taking clothes to dry cleaning and mending clothes. And I was like, sometimes we just do
Other
what-
duties as
Yeah, we
needed.
just do what needs to be done, so. And then just like with the Westlaw accounts have gone up for the services accounts, we saw that in the prosecutor's office, and so we're just asking for an increase to be able to cover that.
Do you have
for
the
this.
new breakdown?
I'll get
'Cause when
that.
Okay, I say, because when I add this up, it's the 9,200. 3,000 plus 62 is 9,200. So,
Okay.
just in the
I'll get
description on
back
the
with
side.
you to make sure that's correct.
Perfect.
Okay.
And you did, as of 10/1, that's gonna, the public defenders will be taken off, correct?
That is correct.
Yeah.
And then, okay, there might be some changes potentially to the prosecutor's number of what they need. So can I just communicate that with you?
This is the judges, not
Right,
prosecutor.
no, I know,
Okay.
but you guys have always handled the contract?
Yeah, the Supreme Court handles the contract. Oh, yeah, I'll handle the contract for the
Okay.
prosecutors.
Right.
Yeah.
So if we have any changes, just work with you?
Yeah,
Okay.
for sure.
Thank you.
I've already set all that up previous with the new contract, that they're aware of that and that we would be able to do the reduction and still have the same rate, even though it's less people.
Okay, thank you.
And then just, we're requesting to maintain the same trial expenses. We'll have PEC, and then if any other, hopefully nothing major happens again, but to be able to have a grand jury or a jury selection. And then we already covered the reduction in postage. We are requesting, we're a little bit behind on the courtroom remodels because they've been pulled away to go to do ARPA funds and time-sensitive things like the assessment center and all that. And so we're keeping the Supreme Court updated on that. They're still we still have funding for all the audio and those needs to be able to keep the record. But we've asked for up to $40,000 to roll over from this year to be able to complete 320. And then next year our request is to be able to do a remodel for courtroom 113.
And we'll look at reserves to cover those. At least the 60.
And then we'll do, the 60, and then we'll, out of the Court Facilities Trust, then we would match that with our funds to be able to do that. And then Dan has built into his request to be able to continue. The main reason for that is if you look at Judge Penrod's and Judge Thompson's courtroom, they're, from the 70s, we didn't have an ADA assessment done, and they're very out of compliance. And so we're hoping to be able to catch them up to the modern courtroom and be ADA compliant. The witness has to get up onto a step. The steps themselves don't meet code, and then the juries have to get up onto steps, and those don't meet building code, but they also don't meet ADA. So we'll make sure those are flush and that we can have ADA access to them.
They meet the code so far because they haven't been remodeled.
Right.
They meet code.
Yeah. Yeah, as far as ADA, we haven't had a model, but we're making sure that as we go forward. I just went to a conference and it was good timing because there's some code issues with the new remodel that we just met yesterday with Dan and with Judge Jarman. She's not going to be as happy because it won't be a traditional bench where, they're super high, but we'll be able to meet codes, and it's especially important on a new remodel that we're able to do that for ADA.
Any questions on that?
No? Anybody else? Questions?
Nope, I don't.
And then within the, he's got a couple trusts, but within those, that's where he mentioned some money for the remodel. And then we've got a couple other trusts that pays for like domestic violence, some trainings and stuff like that. Do you want to go through those?
Request or
Those? Okay.
covered?
Yeah. These trusts usually run off participant fees and then cash forward.
Okay. All right. Thank you.
All right, thank you.
With that being